Hello, everybody. My name is Sean Halsman. I'm a paramedic and an EMS educator, and I'm making this video for people today to understand a little bit about PPE. COVID-19 is obviously a thing out there now. It's right in the middle of a great pandemic, and people are understandably afraid and don't have a lot of great information. It's a new virus. People are working on trying to figure out the specific attributes of these viruses. But in the meantime, people are trying to protect themselves, which I totally understand and would never question anybody on trying to keep themselves and their families safe. One of the big discussions that has come up recently is the discussion of PPE, or personal protective equipment. And what PPE is for medical providers are goggles, masks, gloves, gowns, things that we would normally use to protect ourselves in a situation where we have a patient who's potentially infected with some kind of disease or pathogen, and then that keeps us safe. PPE is designed for medical providers. It's something that we keep on hand for the most part. As you have heard, there is a shortage of PPE right now due to a couple of factors. One, I believe, is just poor planning, and the other one is that stockpiling by certain individuals in certain places that felt they needed the PPE, and it's not available for medical providers. There are different types of PPE, and they all serve different purposes, and we would use those different PPEs in specific situations depending on the risk they're present for us. So what we've noticed now is that there's a lot of laypersons out there who are non-medical providers who have got their hands on PPE and are using PPE. And this has made some of our medical staff and people out there, nurses, doctors, and paramedics, EMTs, angry because they see laypersons now wearing these things around the supermarket or out in public, and they think to themselves, well, we don't have enough of it. Why are you guys using it out there? And again, I get it. I get that people are a little bit concerned and want to take care of themselves. What it really comes down to is this. There's a good chance that you don't need it as a standard person going to the store, and we'll talk a little bit about that. There's been a lot of pushback and even poking fun at people from medical professionals who see these individuals using PPE out in public, and I don't think this is the time for anger and for divisiveness. I think that unity through education is probably a good thing. So what I want to talk about a little bit is how to use PPE, what it's for. If you are a layperson and you do have it, make sure you're using it properly, because if you're not using it properly, it is conceivable that you actually could put yourself at risk for infection from not using it properly. So this is what this video is going to be about. If you are a person who has some PPE and are using it on a regular basis when you go out to supermarkets or wherever you are going during this quarantine social distancing time, this video is for you, and I'd like to just talk a little bit about the specific stuff that we have or that's available and how you might use it better. Bear with me through a little bit of science. Not too much, a little bit of terminology, but I promise there will be a good point to this, and this will help make you a little bit safer if you are using some PPE. So before we start, it's important to understand how COVID-19, which is this coronavirus that's out there, is transmitted, and how people get it. Right now, it's new, as I said, so we don't have a lot of information about it, but it's transmitting in a lot of the same ways that the common flu transmits, or other coronaviruses, such as the common cold and other types of viruses there. And basically the World Health Organization at this point thinks that the main routes of transmission are from surface contact, where there is virus on a surface, and then somebody touches that surface and gets the virus on their hands, and then touches their face, rubs their eyes, puts their finger in their nose, whatever the case is, and gets the virus into themselves that way, or through what they call droplets. And droplets are produced when a person who has the virus will cough or sneeze, and creates very tiny droplets of moisture from their mouth and throat, and the virus can hang out on those droplets. And as we go into this discussion of droplets, we want to really talk about sizes of these particles, because I'm going to talk about big particles, but they're actually very small in comparison to things that we'll be familiar with. So when we talk about droplets, we talk about something that's about 5 micrometers or larger. For basis of comparison, the width of your hair, a human hair, is somewhere in the 17 to 150 micrometer diameter. So we're talking about particles that are much thinner than, or much smaller than, the width of a human hair. So very small, but we, as droplets, we consider those large particles. The other thing that can occur with patients is if there's a lot of stirring up of some of this moisture as it comes out, or if it evaporates over time, we can get very small particles, which are considered aerosolized. And aerosolized particles are smaller than 5 micrometers, and they're very much more able to get into smaller spaces. So at this point, the World Health Organization does not have any evidence that this particular virus is aerosoled under normal conditions. Again, we're still learning about it, and they're still learning about it. But what we really need at this point is droplet protection for ourselves, meaning that we're not getting bigger droplets into our mouth, into our nose, into our eyes from somebody sneezing or coughing. And that should suffice for now. So there's a couple different masks that are out there, and one of the masks you'll see, I'll see if I flip over the picture here, it's a surgical mask. This is a standard mask that surgeons wear, people wear during medical procedures, and these masks are designed to protect the patient from something that the provider may have, especially in the surgical arena. So this is droplet protection. So if the surgeon coughs or sneezes or has anything like that going on with large droplets, the surgical mask will keep that from falling into the arena with the patient there. So you'll see people out there with these surgical masks, and they are droplet rated, so they'll stop droplets in the air. The second type of masks that you will see are the N95 masks, and you've heard a lot about these. The N95 mask is different in that it is specifically fitted for a medical provider, and it's what the medical provider wears to protect themselves from droplets and aerosols. So even the very small particles are mostly filtered out by the N95 masks. In either case, you would need to have very close contact with somebody who has the virus, who's coughing or sneezing, or be doing procedures on that person, such as putting in a breathing tube or doing CPR and using an ambu bag for during compressions, and that can aerosolize particles. So when we are in the field doing those types of procedures, we're wearing N95 masks. The second thing that comes into play with N95 masks is that they're specifically designed to be fitted. So whereas surgical masks could be put on anybody, the N95 mask is a mask that we are all fitted with, and we actually do a test with them with some bitter tasting nebulized stuff, and we wear the mask, we spray this stuff around the mask, and we take some breaths, and we make sure we can't taste it, and that indicates that the mask has a good fit for us. So if you're not wearing either one of these masks properly, whatever benefit you might get from the mask is probably not going to get there. Now, droplets, the larger particles, hang in the air for about 3 to 4 feet. That's kind of the current guidance. So these droplets will be coughed out or sneezed out. They would hang in the air for 3 or 4 feet diameter, and then gravity would pull them down to the ground. So the viruses on those droplets would sink to the ground. They would no longer be available to hit you in the mouth, hit you in the nose, get you in the eyes. Any one of those mucous membrane type places is where the virus can pick up from droplet type stuff there. So if you're not, again, within 3 or 4 feet of somebody who's actively coughing or producing these droplets, then chances are good that you don't need a mask at all. And if you're practicing good social distancing at this point, you shouldn't be that close to somebody. So keep that in mind as you're out there. Again, if you're concerned, you're wearing the mask, that's great. I'm going to show you in a second how to properly wear an N95 mask if you do happen to have those. But the chances of you at a social distance of 6 feet actually getting droplet particles anywhere near your face is not really a big one. So this is the standard N95 mask. There's a lot of different types out there, and what you'll see is a couple things. Most N95 masks, whether they're the molded type that are in shape or these type here, have 2 straps on them. One strap goes over the top of the ear, the other strap goes down behind the neck, and those 2 straps provide more pull to the face to keep this sealed. And I'll put this on right now and show you. So I'll have my first strap go behind my neck. Next strap goes behind my ear. You want this to cover your face and get a seal. Up on top here, there's usually a little metal tab that bends around your nose. You can squeeze it here, and this hopefully gets a seal for you. So if you're using N95 masks, you want to have this seal. A lot of times you can tell there's a good seal because when you breathe in, you'll see this collapse. And what this is doing is for the provider or the person wearing it is filtering out even aerosolized particles that would be in the air that we could breathe in, that would get into our throat, get into our nose. Important to note is this: regardless of what mask you're wearing, if you do encounter some kind of aerosolized particles or droplet particles that contain a virus of any kind, including COVID-19, those particles stick right here. They get filtered out by the mask, but they're on the mask now. So the big problem that we have in using masks such as this is not that they don't work. It's that when we take them off, if we do this in such a way that we touch the outside of the mask a lot, we're going to transfer all the viruses on the mask onto our fingers or whatever else we're doing here. If you pull this straight over your head and rub this on your face, you'll transfer these viruses onto your face. So here's the goofy looking way to remove N95 masks so that you don't touch the outside. What you do is you stick your neck out here, you grab the straps, pull the straps back, and bring the whole thing up over your head. Now notice that this mask right now is not touching my shirt or anything else. And I'm going to pull this straight over, and the mask has been removed. We're going to assume right now that there's a potential that I have viruses on the outside of this mask. So re-wearing it becomes an issue, because when I put this back on, if I don't do it properly, I could rub this all over my face while I'm trying to get it back over my head. And this is why they don't really recommend reuse of masks. Now, what you're seeing in the news is that the CDC is trying to relax a little bit of its guidelines because there's just a shortage. So they're asking some providers at hospitals especially to reuse these masks. If you're going to reuse a mask, you have to be very careful when you put this back on that you're not touching the outside of it. There are some anecdotal ways in which you could maybe sterilize the outside of the mask. I have read that you could put this into the dryer on high cycle for high heat for 25 minutes. If that works, great. These straps are really tiny rubber. They may melt. I don't know for sure. But these masks in ideal conditions are one-time use. You would remove it carefully and then throw it away. All right, so that's masks for that. If you are using masks, even a surgical mask, understand the outside of that mask may have stuff on it. When you remove it, you really don't want to use it again. And again, these are in short supply, so do what you think you have to do. But as I said before, you may not need a mask if you're just going into the grocery store to pick up stuff and you're not going to stand close to anybody who might cough or hack on you. You probably won't need this mask. Second route of transmission, which is what I'm doing right now, unfortunately, is we all do it. It's touching our face. If you go through an area where there are viruses and a virus load on a surface and you touch those surfaces and then you touch your face or fix your glasses or whatever, that's how you can spread. So one of the things that they've been preaching since the start of this whole thing is to, first of all, not touch your face, which is really hard for most of us, including myself, as you've seen several times in this video, but also to wash the hands frequently. If you're washing your hands frequently, then you're taking any virus load that are on your hands and hopefully getting them off. So if you do touch your face, you won't have an issue. So the next thing we've seen in public is we've seen people with gloves. All right, these patient care gloves that we have here, latex, not really a thing anymore. They make them out of a new stuff called nitrile, but these are gloves. And we'll see people walking around supermarkets wearing gloves. All right. Here's the problem with gloves. They give you a false sense of security. Now, as a medical provider, I put on gloves when I have a patient who's bleeding, who has secretions, who has some kind of bodily fluid that I want to isolate my hands from as much as possible, because I don't want it on my hands, obviously, so that I'm not going to transmit disease to myself. So when we put on these gloves as a medical provider, we will make contact with our patient, we'll put the gloves on, we'll treat the patient as need be, and as soon as we're done with those procedures and treating the patient, we remove the gloves. All right, now, if I don't remove the gloves, anything that I've touched is still on the gloves. you can't see viral loads because they're invisible, because they're microscopic. So I have a little cup of powdered sugar here, and that's going to show you what was happening in a lot of these laypersons wearing the gloves out in public, right? Good idea. You think you're going to protect yourself. That's wonderful. But here's the thing. You go to the supermarket. You pick up a can or a box of something that somebody with COVID has previously touched, and now there's some viral load on there, right? You're getting that on your fingers. So here is my viral load on my fingers, and I'm just using the powdered sugar so you can see it, okay? So now this is on here. Now it'll be invisible because we wouldn't know it was there, but I go through the rest of the store, and everything I touch with this glove is now getting the viral load spread to it. If I scratch my nose, all right, I have viral load on my nose. If I take out my cell phone and call my significant other, hey, how you doing? We're just shopping today, right? I've put viral load on my phone. So I see a lot of people in the stores who will be shopping, taking this out. They take their wallet out at the cash register. Oh, I'm going to pay for this. All right, I'm going to take out my credit card, and their gloves are still on. So here's what you're left with. When you get to the car, and you're all done with your shopping and you think you've been safe because of your gloves, you remove your gloves, and then you have your cell phone with coronavirus on it. You have your wallet with coronavirus on it, your nose with coronavirus on it, and you really done nothing to protect yourself, and you actually could even put this on your steering wheel if you don't take your gloves off right away. So we're moving things around there. Now, I'm going to remove some of that coronavirus off my nose. I'd like to show you the way to remove gloves so that you can properly keep yourself from getting exposed. Once you've touched stuff, pick something up that you think could possibly be infected, you don't want to wear these gloves anymore. They're now, full of viral load. So taking gloves off, the first thing you're going to do is you're going to take your gloved hand on one side and you're just going to pinch the palm of the other glove. Notice I'm only touching the outside of this. I am not touching the skin on my hand. With that, you're going to pull the glove inside out gently. All right, so now this is the inside of the glove where my hand was, and there theoretically is no viral load on this because it was inside. While holding this one, you're going to take that, this is the tricky part, you're going to slide your other hand's fingers underneath the cuff of this glove on the inside, and you're going to remove it again inside out. So you have two gloves inside out, and you're done. These get thrown away in a garbage, please. Don't put them on the parking lot ground. Not cool. These go in the garbage, and then immediately afterwards, you would use sanitizer or preferably soap and antibacterial soap, and you'd wash your hands and then move on. All right. So if you are using gloves out in public, you can't keep them on the whole time. You're going to infect yourself with stuff. They need to come off after you touch things. And in the meantime, you should be touching your face, touching your purse, touching your shopping cart, and all those type of things. The best thing to do, honestly, is just to wash your hands. You don't need the gloves. Viruses don't get in through your skin if you don't have any broken skin or wounds. The viruses can be on your fingers, and then when you're done where you're at, you wash your hands. And then if you happen to have brought your cell phone in with you or your wallet in with you, those things, when you get home, you're going to want to wipe those down with some kind of Clorox cleanup or antibacterial stuff, to wipes to keep them clean too. So bottom line is that you probably don't need the PPE as a non-medical provider. If you have it, use it properly. Just be aware that there are some dangers in taking it off and putting it on, and that you still can spread this virus around into yourself if you're not doing things properly. I really hope you guys are all being safe out there. I know this is a scary time. It's a scary time for us in medical services. We're kind of waiting for the big stuff to hit here in New York State. New York City obviously is already the epicenter, but we're waiting for that to kind of spread out a little bit. So please be well, be out there, practice social distancing, wash your hands, don't touch your face, and hopefully we'll get through this nicely, and come middle of summer this will start to drop off and life will start getting back to normal. So thank you very much for listening. If you have any questions, you can email me. I'll put the email address down there for my work email. I'd be happy to answer any questions for you. We just want everyone to be safe out there. So take care. God bless.